Hello, and welcome to the GRS GHC Safe Resident Handling Training on Active Transfers. After this course, you will be able to understand the importance of a safe resident handling program, describe the most common types of transfers, list key points to ensure safe transfers, and review proper technique for assisted falls. Why does Genesis have a safe resident handling program? The first reason is for employee safety. We want to reduce employee injuries by using proper techniques, and this provides a safe work environment for all staff. The second reason is resident safety. It reduces skin tears, bruising, and subluxations through a consistent evaluation process of residents' ability. The next reason is it is an OSHA focus area. Nurses and nurses' assistants are some of the most injured professions, which is why OSHA has this as a focus area. This will help us see what the center has in place to help decrease employee injuries. It's also a best practice. In 2013, the American Nursing Association came out with national standards for safe patient handling. And also, some states have legislation in some form for safe resident handling. So who is involved in the Safe Resident Handling program? The SRH program requires company-wide participation. Center licensed nursing staff evaluate each resident to determine the safest method for transfer and repositioning. Clinical staff have a primary role in executing the Safe Resident Handling program, but non-clinical team members are very important to the program's success. Each resident has an evaluation to determine if a lift or transfer technique and/or other assistive devices are indicated for the safest transfer and repositioning. The goal of the program is for residents to maintain their highest level of safety, function, and independence as long as possible, while also protecting the health and safety of our staff. The program is designed to eliminate the need for heavy lifting, transferring, or repositioning. It is important to communicate the transfer or equipment status of every resident. The results of the lift transfer evaluation will auto-populate to the care plan in Cardex. Centers need to develop their own consistent form of communicating lift transfer status with the staff. This may include stickers, care planning, Cardex, care cards, etc. A gait belt is a device used to assist a resident in ambulation or transferring to and from various surfaces. A gait belt helps you provide support to the resident while decreasing the risk of falls and decreasing your risk of injury. GHC policy states that a gait belt is used with patients and residents who can safely ambulate with assistance and/or perform greater than or equal to 50% of lift transfer with stand pivot assistance with one staff member. Use of two staff members may be care planned for monitoring and/or safety as indicated. When using a gait belt, it is important to follow these general steps. Inspect the gait belt for safe use. Ensure there are no tears and all fasteners are in working order. Place the gait belt over the resident's clothing, around their waist, and tighten snugly. Recheck the belt to ensure it's secure. Stand close to resident during the transfer. Place both hands on the gait belt, reaching around the back of the resident. A transfer is any movement from a sitting to a standing position, standing to sitting position, or from one surface to another, such as from a bed or to a chair. A consistent pattern of movement is followed to complete the transfer in a manner that is safe and efficient for both the resident and the caregiver. There are many different types of transfers, but they all include basic principles that must be followed for success. Today, we are going to talk about the most common types of active resident transfers. Prior to completing any of these transfers, it is important to review the care plan to determine the appropriate type of resident transfer. Introduce yourself to the resident and verify their identification. Explain the type of transfer to the resident and provide privacy if able. When possible, plan to transfer the patient towards the resident's strongest side. There are key points to remember about the transfer and the transfer surface. First, be sure the surface is stable. If it is a wheelchair or a bed with wheels, be certain the wheels are locked. Inspect the surroundings and remove any tripping and fall hazards. The surface should be firm and offer good support. Ideally, the transfer surface should be at the same level or height that the person is transferring from. If the transfer is to a wheelchair, have the footrest off of the chair or out of the way. If completing a stand pivot or sliding board transfer, you may consider removing the armrest on the side that the person is moving to. Place the surfaces at a 90-degree angle to one another or as close together as possible. Be sure to explain each step as you go. Let the resident see in what direction he or she is moving. Be sure to have the resident use his or her own function and strength during the transfer. Sit-to-stand transfers are often used to prepare for ambulation or to perform ADLs. Prior to completing a transfer, the caregiver must first complete necessary preparation, including the setup of the environment, securing the gait belt on the patient, and explaining the transfer. The transfer process can then begin. So the caregiver bends their knees and maintains their normal curves in their back and neck. Lean the patient slightly forward, ensuring patient's feet are under them, not in front or behind. Instruct the patient to assist by reaching back to the chair armrest or bed and pushing off. Do not allow the patient to grasp the caregiver around the neck during the transfer. Brace the patient's leg just below the knee with a caregiver's leg to prevent knee buckling. On the count of 3, rock the patient forward and up, instructing the patient to push off the chair arms or the bed to assist. You'll also assist as needed to place the patient's hands on the assistive device and make sure you wait a few seconds before starting to ambulate. For stand-to-sit transfers, the critical steps for the caregiver include inspecting the environment to ensure surfaces are in a safe and working order, instructing the patient to back up to the chair or bed edge until the back of the thighs touch the surface. Instruct the patient to reach back with one hand at a time to hold the armrest or to touch the mattress. Slowly assist the patient in lowering themselves to a sitting position. After the patient has been assisted to a seated position, provide assistance with repositioning as needed. This includes assisting them to move completely to the back of the chair or bed in small increments, allowing them to assist as much as possible. Sometimes it is best to repeat the sit-to-stand and stand-to-sit transfer to achieve the safest and most comfortable seated position.
Good morning, Mrs. Smith. My name is Jessica, and I'm your physical therapist. I just put on your gait belt, and today we're going to practice getting up from the chair. First, what I need you to do is I need you to lean forward towards me. Very good. Put your hands on the armrest. Can you scoot your whole buttocks to the edge of the chair, please? Good. Very good. I'm going to hold back here on this belt, and what we're going to do is I need you to lean your body forward, and you're going to push from the chair, and then you're going to stand and put your hands up here on the walker, okay? Okay. On the count of 3, I'm going to help you. 1, 2, and 3. Push, 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 push. Good. Good job. Can you take a step inside the walker, please? Very good. Stand up nice and straight. Great job. Now what we're going to do is we're going to practice sitting down in the chair, okay? What I need you to do first is I need to make sure that we're going to take a step back towards the chair. Very good. Now let's bring the walker with you. Stay inside the walker. Very good. Step back again until you feel the back of the chair. Excellent. Now what I need you to do is reach back towards the chair. Both arms reaching back, and gently, very gently, lowering yourself down to the chair. Very good. And I'm helping you with the belt. Great job.
Thank you.
Good job, Mrs. Smith.
A stand pivot transfer has the patient stand, turn or pivot, and then sit down on the target surface. They may or may not be able to come to a full stand when completing this type of transfer. The patient may be able to do the transfer by themselves, or they may need the help of staff to complete. If you are helping the patient transfer, part of your job is to protect them from falling. You must use a gait belt around the patient to ensure that you have a firm surface to hold on to as you assist them. Some key steps for a successful stand pivot transfer include, pause here. Redo slide 14 in 3, 2, 1. A stand pivot transfer has the patient stand, turn, and pivot, and then sit down on the target surface. They may or may not be able to come to a full stand when completing this type of transfer. The patient may be able to do the transfer by themselves, or they may need the help of staff to complete. If you are helping the patient transfer, part of your job is to protect them from falling. You must use a gait belt around the patient to ensure that you have a firm surface to hold on to as you assist them. Some key steps for a successful stand pivot transfer include assisting the patient to scoot forward, to place their feet on the floor, under or slightly behind the knees, lean forward, push up from the seated surface to a stand or semi-stand, turn by shifting weight and or taking small steps toward the target surface, reach back with one or both hands toward the surface, slowly lower to sitting by bending knees and keeping hips back.
Good morning, Mrs. Smith. My name is Jessica. I'm your physical therapist. Before I came in and I put on your gait belt, today we're going to practice getting into the chair from the bed, okay?
Okay.
Are you ready?
Yeah.
Okay. First, what I'm going to do is I'm going to position the chair. See that these leg rests are here? We need to move these out of our way so we don't trip on them and we don't get our legs caught up on these leg rests here. So let's move this out of the way. Okay, I'm going to put them off to the side here. Next, I need to make sure that the wheelchair is positioned so that the brakes are locked. So we don't want the wheelchair to move away from us, right? And then I make sure that these wheels are out of our way too, okay? And I put the chair on an angle so it's easier for us to get into the chair, okay? What we're going to do now is I'm going to put my legs in between your legs so I have good body mechanics. I want you to scoot your buttocks to the edge of the bed for me, please. That's it. Very good. Making sure your feet are nice and wide apart, that they're flat on the floor. Great job. Okay. What I'm going to do, Mrs. Smith, is I'm going to put my hands on the belt. I'm going to count to 3. You're going to help me as much as you can, and you're going to push from the bed. And then we're going to stand, take a step, and we're going to put our arms and reach back for the chair and lower ourselves down. You ready?
Okay.
Here we go. Ready? 1, 2, 3. Stand up tall. That's it. Keep turning. Turn, turn, turn. Nice and slow. Reaching back. Gently lower yourself down. Nice job. Okay, Mrs. Smith. What we're going to do now is we're going to sit back on the bed. We're going to practice the transfer the opposite direction, okay? If we were somewhere else, we would do the same thing. We would remove the leg rest. We'd make sure that the chair is locked and that it's positioned next to the bed on a slight angle, okay? Since we're moving to this direction, I'm going to put my feet in between your legs. Let's make sure your feet are nice and wide apart. So then that way it's easier for my body mechanics to stay right in line with you, okay? What I need you to do is I need you to lean forward. Scoot your buttocks towards the edge. Very good. Okay, make sure your feet are flat on the floor with your feet nice and wide apart. Your arms are on the armrest. I'm going to hold my hands on the gait belt. We're going to count to 3 and rock and lean forward. We're going to stand, and then we're going to take a step and turn and sit on the bed. Ready? 1, 2, 3. Push, 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 push. Turn, turn, turn. Reach back for the bed. Slowly lower yourself down. Great job, Mrs. Smith.
A sliding board transfer is used when the patient can actively transfer but cannot bear weight on their legs. This type of transfer involves having the patient move from one surface to another in a seated position, using a sliding board under them as they slide or progressively lift themselves and move across. Some key steps for a successful sliding board transfer include bringing the surfaces close together and locking the brakes, removing both leg rests and arm rests on one side, placing the sliding board under the buttocks and the other end onto the surface the resident is transferring to. If possible, place the patient's feet on the ground for balance. The patient then raises the buttocks and makes small movements toward the intended location. The caregiver ensures safety throughout. And once the resident is firmly on the new surface, remove the sliding board and assist to reposition as needed. It is important to always be prepared to assist a patient in the event they lose their balance while transferring or walking. Make sure that all of your attention is on the patient when you are with him or her. If a patient does begin to lose his or her balance, try to brace your body against a stable surface like a wall or a counter. Always create a broad base of support by spreading your feet and slightly bending your knees. If the patient is close to you, lower the patient to the floor in a controlled manner, using your body as a slide to guide the patient down gently. Make sure you bend your knees as you are lowering the patient. It is a good idea to practice this technique with your coworkers to make sure you're prepared in the event that you need to assist the patient who has lost his or her balance. Keep in mind that even if a controlled fall is not possible, it is critical to protect the patient's head.
I'm just going to walk to the living room, okay?
Sure, I'll be right behind you.
I'm feeling faint.
Okay, I'm gonna lower you down to the ground. Here, let's protect your head. Very good. I'm gonna go get help, Mrs. Smith. If you're ever walking with a resident and they need to be assisted to the floor, make sure that you have both your hands around their hips and then lean their body weight against your body weight, against your leg with your legs apart so you can help use the strength of your legs to help lower them to the floor. Make sure that as you're lowering them that you're always protecting the resident's head. Make sure that they're safely on the ground and then call or ask somebody to open.
If a resident were to fall, an assessment by a licensed nurse must be completed before moving a resident who has fallen. Once it has been determined that the resident is safe to move, a total lift must be used to lift the resident from the floor. If it has been determined by nursing or medical evaluation that it is not safe to move the resident, follow the established accidents and incidents policy at your center. To ensure timely reporting and treatment, all employee injuries related to transfers must be reported to your supervisor as soon as possible. Additional information or questions concerning the Safe Resident Handling Program can be found at the site listed here. You can also contact your center NPE or CNE, and additional questions may be directed to your clinical quality supervisor. Thank you so much for taking the time to learn about active resident transfers today.